Hi, everybody, and welcome to our Advocate webinar for June. We are so excited to have you here with us today to talk about the CDC Arthritis Program, how our advocates are engaging in the investment process with appropriations this year as it comes to the CDC Arthritis Program, and what it means for all of you. We're really glad that you're with us, and we've got a robust amount of slides to go through today. So bear with us as we go through the beginning housekeeping slides, and then we'll get to the really good meaty stuff. As a point of introduction, we have two guest speakers with us here today, Vincent Pacilio, Director of Federal Affairs, to give us a snapshot of what the appropriations process looks like, and our awesome Platinum Ambassador from Illinois, Cindy Copenhaver, who has a really amazing background, not only advocating for Research for a Cure, but also delivering on exercise programs for her community that really move the needle on health outcomes for people with arthritis. Before we get started, I just wanted to give you an update on our advocacy leadership team map. You may have heard that our Senior Director of State Legislative Affairs, Ben, is moving to Washington, D.C. from his hometown of Boston, and as a result, Mary Bartlett's region is expanding. So take a look. If you're in the Northeast, you may have some new orange in your states, and that is just to indicate that Mary Bartlett is taking over those states there. And she's a really amazing resource for advocating at the state level. She's based in New York, and she's been with the Arthritis Foundation for about a year, and she'll be an amazing resource to all those in the Northeast. And welcome, Ben, to your time in Washington, D.C. For today's call, we have three buckets that we're going to discuss. The first is appropriations, which is a clunky word. We're going to talk about what it means, why they're important, how often they happen, and go through any of those questions that you might have there. Then we're going to talk about the CDC Arthritis Program, which right now we know is a research organization, but what does it really do for patients? We'll tell you. And then in the end of our call, we're going to have Cindy talk about how her patient story has led her to becoming a leader in this space, and some of the ways that patient stories can fuel action as it comes to appropriations and investments in research. So to kick us off, I'm going to pass the microphone over to Vincent Pacilio to talk about appropriations.
Thanks, Julie. Let's get started. All right. So, as many of you may know, we have kind of three big buckets from the federal policy side in terms of priorities for the foundation and the arthritis community. Those three you can see here on the slide are access to care, research and prevention, and awareness. And just to highlight a couple of those, and in each of those buckets, we care deeply about the pediatric rheumatology workforce shortage. That's a big access to care issue that we hear a lot about from all of you. Research for a Cure and making sure that there are enough funds available to continue the important work done at the NIH, for example. And then the awareness bucket, which is mainly centered around building up and supporting the bipartisan Congressional Arthritis Caucus. So, there are a lot of words on this slide, but the key thing I want you to take away is that the appropriations process is basically the way Congress makes annual decisions about how the federal government will spend money. And so that's the way that we are able to get investments in arthritis research through that process, is by engaging during this annual exercise that Congress goes through. So statistics that I don't need to mention to you is that there are 54 million Americans with doctor-diagnosed arthritis and 300,000 kids with arthritis, and it's the #1 cause of disability in the U.S. We all know that. We also know that there's no cure for arthritis, and for some forms of disease, there's no disease-modifying therapy, which, again, heightens the sense of urgency for dedicated research. And because of all those statistics, it's really important that federal investments start to meet the actual disease burden from arthritis. So what can we do to secure additional funding? Well, as I mentioned, that annual process that Congress goes through, called the appropriations process, is where Congress starts to take a look at last year's budget and how they want to set priorities for the upcoming fiscal year, and they will make decisions with obviously limited resources, aka money, to be able to do that. So what we can do as one arthritis community is elevate our voices to our representatives and their staff about why arthritis should be on their radar, and also having an understanding of why the appropriations process is important. So I touched on this a little bit on the last slide, but just to give you a very, very high-level overview of how the appropriations process moves forward every fiscal year. We always start at the beginning of the year in either February or early March with the President submitting a budget request to Congress. That's really a blueprint for the President's priorities for the upcoming fiscal year, and it's really just a good document that Congress can start from to kind of start that negotiation around what funding will be allocated for different programs. So the Congress receives the President's budget around that February or March timeframe, and then they set to work on dividing up different funding streams for various committees that have oversight over certain aspects of the budget. So, for example, some of the healthcare committees in both the House and the Senate have oversight over the National Institute of Health. They'll take on the budget allocation for that funding and will decide where to place priorities for the upcoming fiscal year. So as that process is going, we're starting to enter early summer, possibly, when the House and the Senate start voting on and passing some of these appropriations bills. And so what usually ends up happening is that the House and the Senate will reach a different conclusion. They'll have different levels of funding for NIH programs, for example, or the CDC's Arthritis Program, as we'll talk about in a minute. And so what ends up happening is that they need to reconcile those differences and come together and compromise. As you all know, Congress is sometimes challenged in finding those compromising levels, but they do attempt to do that every fiscal year in order for the President to sign a bill in law. So this is just a great example of here how advocates have engaged in the appropriations process throughout the last several months. The one we wanted to highlight here today is around Jingle Bell Run season last year, where advocates sent more than 600 messages to members of Congress about federal appropriations and really kind of teeing up the key issues that we work on every year and advocate for with them before we hit January. So we just wanted to highlight here that this is kind of a really great drumbeat exercise that we all go through every year. I know sometimes it can seem what's the word I'm looking for? I can't think of the word, Julie. All right, I'm looking at Julie for the right word. But sometimes I think the process can be discouraging. There's the word I was looking for, guys. Discouraging and long.
Just lengthy process.
Lengthy process because of the way Congress works. But judging by the 600 of you that sent messages and the great engagement we've had since then, it's really about keeping the drumbeat up and keeping your spirits high, because members of Congress will hear you, and they are hearing you, and it's just keeping that energy up. So. Right,
and I think it's so important to remember that as you are working for Jingle Bell Run or for Walk to Cure Arthritis or any of your fundraising activities throughout the year that support Arthritis Foundation mission, as you kind of channel some of that background into the appropriations asks that we've had, either at the Advocacy Summit or through an action alert like this one, it really shows our members of Congress that you're not just asking for an investment in arthritis, you're also walking that walk and doing your part to support research for a cure as well.
All right, so with that example, where are we now? Well, as we're going to hear a little bit more about in a minute, the CDC Arthritis Program is one of the key appropriations asks that we work on every year, and it's trying to boost that funding. So good news to share with you all today is that the House Appropriations Bill this year has a $1 million increase in it for the CDC Arthritis Program, and so that funding would go from the House bill from $11 million each year to $12 million. So we're really excited about that. It's the first meaningful increase offered by either the House or the Senate for this program in the last several years. And so really what we're doing now is we're thinking about the Senate, because the Senate hasn't taken any action yet on their own spending bills. They plan to do that probably after July 4th. And so what we need to start thinking about as a community is when the House and Senate come together, making sure that that $1 million increase is on our senators' radars so they know that the House has already taken action and they should rise to the challenge of also including a $1 million appropriation. So with that, I'll turn it back over to Julie.
Awesome, thank you so much. And we'll pair you with some opportunities to take action, to connect with your senators later on during our call today. But before that, we're going to try to teach you about why the CDC Arthritis Program is so essential and exciting for people with arthritis around the U.S. So what exactly is the CDC Arthritis Program? It sounds kind of fancy, kind of cool, but the CDC Arthritis Program just works to protect the 54 million American men and women with arthritis across the United States, and they do so in three main buckets. The first is that they try to expand the science base by collecting prevalence data and trend information about how communities are impacted by arthritis. That information directly fuels our resources at the Arthritis Foundation, like Arthritis by the Numbers and our state fact sheets. Both of those resources are incredible assets as you're talking to members of Congress or your state legislators about how impactful arthritis is on their communities. The other thing that our CDC Arthritis Program does is support state health departments by providing funding for proven exercise programs and resources that help improve health outcomes for people with arthritis. And we're really going to talk about some of those things a little bit later on when we're talking with Cindy, who is a certified exercise program trainer. So I'll let her take care of that area. But the important thing is that the CDC Arthritis Program seeks to address underserved communities, particularly in rural areas, that have difficulty accessing those resources that are so essential for managing arthritis. So using the CDC Arthritis Program funding, there are 13 states that currently receive funding to help improve those health outcomes. So in areas where there are workforce shortages or difficulty accessing medications or really any of those exercise programs, the CDC Arthritis Program comes in to help address that. The other thing the CDC Arthritis Program does, and I think this is one of my personal favorite elements of the CDC Arthritis Program, is that they work with national partners to help advance all of their mission goals and help advance our mission goals as well. And the Arthritis Foundation is actually one of those national partners. So is the National Association of Chronic Disease Directors, the OA Action Alliance, and the National Parks and Rec Association, where we can offer some of these amazing exercise programs nationwide. So we have all of these elements that are really making the CDC Arthritis Program great. One of the most important things where we align with the CDC Arthritis Program is through the Arthritis Foundation's helpline. I don't know if you knew, but the Arthritis Foundation actually has a 24/7 helpline that's available for any patient who has a complex or a simple question and just needs some personalized help. We have licensed clinical social workers, who man the helpline and who respond to helpline requests. And there are three different ways that people can send in their question or send in their need to the helpline. The first is by making a direct phone call at 1-844-571-HELP, or by typing in on our website their kind of a form letter style of their question or concern, or they can just email us directly at help@arthritis.org. The Arthritis Foundation Helpline is the only national person-to-person resource for all forms of arthritis, and it's been available since 2016, fielding more than 5,600 calls and emails. And we get calls about all different types of topics: access to medications, to physicians, how to manage your disease, what types of support groups are available, and so on. And the really cool thing is that the helpline has proven results. We know that from a recent survey that 52% of the people who have called into the Arthritis Foundation helpline have acted on the advice given by the helpline representative. And if they haven't taken action, 70% of the respondents do feel that the helpline representative cared about their needs, provided them helpful information, and have a hope to take action on those things in the future. So the CDC Arthritis Program helps us as a foundation deliver this amazing resource by providing funding for the helpline and therefore helping to increase the access to resources and information for patients across the country. You can see in this map the 13 states that are currently benefiting from CDC arthritis funding at their state departments. And so these are different states around the country where if you live in one of these states, you have an awesome ability to reach out to your members of Congress and reach out to the programs, to your state departments, to find out different resources that might be helpful for you and for families with arthritis. There are lots of partnership opportunities or opportunities within our Live Yes Arthritis Network Connect groups where you can pair up with subject matter experts about the CDC Arthritis Program and look at ways that we can increase utilization of these resources. But you also have the opportunity to talk about how impactful resources like the ones here are to your members of Congress to protect that funding. For those of you in the remaining states, if you don't happen to be living in one of those 13 states receiving funding, you can reach out to your members of Congress to talk about those incredible resources, talk about the benefits of the helpline, talk about the benefits of exercise programs, and talk about how much those resources can help move the needle and improve care in your community. So I'm going to let this be our segue into our next speaker, but the Arthritis Program, the CDC Arthritis Program, does partner with some Arthritis Foundation resources that we've helped to develop and other national partner organizations to deliver some proven exercise programs. And I'm going to take this time now to introduce Cindy Copenhaver, our Platinum Ambassador from Illinois. Cindy is just an outstanding volunteer at the Arthritis Foundation, and she's been involved for many years, even as a Platinum Ambassador since 2013. So she's absolutely one of our strongest advocates, and she's come to our Advocacy Summit. She's served as a grant reviewer and a patient reviewer for many different scientific opportunities, and she simply is one of the best that we have. So I'm so excited that she can share her experience with all of you. Her patient journey started when she was in high school with an injury that led to osteoarthritis, and she really has channeled that experience into so much leadership at the foundation and beyond. I'm just going to unmute her line here. Cindy, can you hear us?
Yes. Hi, everybody.
Awesome. Thanks, Cindy. I'll let you take it from here.
Okay, thank you. Thanks so much for having me on the webinar today. I'm excited to talk with our participants about my experience in advocacy. I'm especially excited to share my experience not only as an advocate for federal investments in arthritis research, but also as a certified group fitness instructor and personal trainer. I teach exercise classes to patients in my home state. This helps patients achieve pain relief, help reduce swelling, and in general, improve daily living. Exercise classes like the ones funded by the CDC Arthritis Program are a proven method to help patients improve their physical and mental health as they cope with their patient journey. One of my favorite things about classes is that it keeps people involved. It reminds them that they're not alone, and it gives them a community of peers that they can confide and share with. And not only that, my favorite part, but exercise is the most effective non-drug treatment for reducing pain and improving range of motion. There are a few types of exercises that are especially beneficial to people with arthritis. Walking is number one. It's a great low-impact way to warm up. It's also no equipment necessary way to get active. Everyone can do it. And I instruct land and aquatic classes, which are especially helpful in my own pain management. I particularly like the aquatic classes where the water is gentle on painful joints. The water is multidimensional, meaning that more muscle fibers can engage in the activity, and that the water is more support for the joint. It's less painful than working out on land. And this also means that probably the best benefit is that you burn more calories while you're reducing on the joints. The water also helps with venous flow, meaning that it can help reduce both stiffness and swelling in the joint. You can find an exercise class near you by using the Arthritis Foundation Resource Finder. Simply type in your address and indicate that you are looking for fitness programs and professionals. It's at http://resourcefinder.org. arthritis.org/. That's a long one, right? But don't just stop at getting moving. I also want to encourage you to actively get involved in advocating for research and investments in the cure for arthritis. In my time volunteering with the Arthritis Foundation, I've had many wonderful opportunities. I spoke at a CDC congressional briefing years ago. I have been part of a patient-focused drug development, served as a patient reviewer for a clinical trial review project, served as a patient reviewer for osteoarthritis clinical guidelines with the American College of Rheumatology, and even helped support our friends at the NIH by sharing my story. One thing I had to remember also is you don't have to be an expert in science to care about the science. You are the expert in your patient experience, and when you share your story, you can make a real difference for people with arthritis. I encourage you to take action today by sharing your story with legislators in support of the increase of the appropriations for the CDC Arthritis Program. And consider sending your story to the AF Story Bank so that you can be considered for more opportunities like the ones I've been involved with at the AF. They were wonderful opportunities. Remember, it all starts with us.
Cindy, thank you so much for sharing your experience and encouraging everybody to get involved and take action with us. It's a really empowering story to listen to, and it makes me want to take action. So let's talk a little bit now about how you can take action. We have set up a new action alert in our Action Center that will connect you directly with your senators so that you can share your story through a pre-formatted message about the importance of this federal appropriation increase at the CDC Arthritis Program. You can take action by just simply typing in bit.ly/CDC Arthritis FY 2020, follow the link that's right on your screen, or you can navigate to our Action Center. I want to remind you about some of the ways that we can make our actions most meaningful to members of Congress. Now, yes, this is an easy pre-formatted letter that you can send, but you'll have a more impactful message if you modify your message. So, if you have 5 minutes, I encourage you to not only send your message, but also to modify the subject line. Just modifying the subject line of a form letter can help it navigate its way through spam filters and right into the inboxes that matter most. If you have 8 minutes, go one step further. I encourage you to share your one-sentence story ahead of the message body. You'll see here in this graphic, the message body has an area to add your own story to personalize your message. That's where you can do that. 1 or 2 sentences will really go a long way. And then also modify that subject line. To add into this, if you'd like to also add a closing, maybe you have 10 minutes to spend on this action alert, you can add in a closing, just a thank you from the constituents in your congressional district kind of message that will help make that message really stand out. Finally, if you're having maybe 15 minutes, 20 minutes to spend on this alert, consider weaving your story into the message body itself. When you look at the pre-formatted language, you can see areas that maybe you want to personalize and say, you know, I'm ready to ask for your support because of the patients like me and my child with juvenile arthritis, and I want to talk to you about robust funding of the CDC Arthritis Program. Integrating some of your story into this letter will really help it stand out to your members of Congress and show them that you're not messing around. You really want them to support this increase in appropriations at the CDC Arthritis Program. While you're in the Action Center, I encourage you to press our Share Your Story button to complete our story bank, like the one that Cindy had just mentioned. There, you'll have a number of prompts where you can tell us a little bit more about what drives you to take action, what your patient story or caregiver story has been, and different ways that you can want to learn how to connect, whether it's writing a blog or sending a letter or speaking on a webinar like Cindy just did. You can indicate your interest right through our story banking tool. So click away. At the end of this briefing, we will close out the webinar, and immediately the Action Center link will pop up in your screen. So you should be routed there immediately. And I encourage you to take some extra minutes, press send right away, because it's so important that your senators hear from you today about the importance of this appropriation, so that when it does come across their desk, they know exactly what to do and how to support people with arthritis around the country. With that, we've got about 4 minutes left of our call, and I wanted to open it up for any questions from the group. So I'm going to take a pause here. If you'd like to ask your question live, you can hit #6 to unmute your line, or you can type them into our chat or Q&A feature. Awesome. Hearing and seeing none, I'm just going to give one big resounding thank you to both Vincent and Cindy for sharing with us today about ways that we can engage in the research process. And I'm going to give you all 4 minutes back in your allocated webinar time, and I encourage you to use that time to go and take action in our Action Center. Thank you all so much.
Thank you.